age? Well, we're going to explore exactly what a stroke is, the incredibly different ways it attacks the brain, and how modern medicine steps up to fight back. Okay, let's dive into this. I want you to think of your brain like a high-performance engine. It's running hot and it's running constantly, 24 hours a day, 7 days a week. For that engine to do its job, it requires this massive, completely uninterrupted supply of fuel. So when we ask what happens when the brain's fuel is suddenly cut off, we're looking at the absolute core of what a stroke actually is. It's basically a catastrophic energy crisis on a cellular level. And in this crisis, time is literally your worst enemy. Brain cells need a constant, steady supply of oxygen and nutrients. Without them, we are talking about days or even hours before permanent damage sets in. Brain cells actually begin to die within mere minutes. It is a terrifyingly fast biological clock, because once those cells are gone, the bodily functions they control are immediately on the line. So to really wrap our heads around this, here's our roadmap for the explainer today. 1. When the brain starves. 2. Ischemic strokes, the blocked artery. 3. Hemorrhagic strokes, the burst vessel. And 4. Racing the clock with treatments. Alright, let's jump right into part 1, when the brain starves. You know, the brain relies on this incredibly delicate, complex plumbing system just to stay alive. We're talking about a vast network of arteries tasked with delivering perfectly oxygen-rich blood directly into the brain tissue. Now, as long as this arterial highway is totally clear and flowing nicely, your brain cells have all the fuel they need to thrive. But as you can imagine, this system is super fragile. A stroke actually happens when that absolutely essential blood flow gets suddenly disrupted, and this plays out in one of two very different ways. Think of it like a deadly fork in the road. Either the flow of blood is completely blocked, or a blood vessel physically bursts open. Which brings us to part 2. Ischemic, the blocked artery. So the crucial point here is that an ischemic stroke is fundamentally a plumbing clog. It happens when an artery becomes dangerously narrowed or just totally blocked off. Because of this massive roadblock, the brain tissue downstream is entirely deprived of oxygen. The blood simply can't get past it. Usually, this catastrophic blockage is the work of a blood clot, and the second that flow stops, the affected brain tissue starts dying. And you might be wondering, where exactly does this clot even come from? Well, it generally happens in two specific ways. The first is what's called a thrombus. That's a clot that forms directly inside a brain artery itself, slowly building up until it just totally blocks the flow. The second is an embolus. This is a clot that forms somewhere else in the body entirely, often down in the heart, breaks loose and takes a ride through the bloodstream until it gets wedged tight in a narrow artery up in the brain. But whether it's a thrombus or an embolus, the end result is that same dangerous ischemic stroke. Let's shift gears to part 3, hemorrhagic, the burst vessel. Okay, so if the ischemic stroke is a clogged pipe, the hemorrhagic stroke is quite literally a burst pipe. This occurs when a blood vessel simply ruptures. So instead of just failing to deliver blood, the vessel breaks open and bleeds directly into or around the brain. And this is unbelievably destructive. Not only are those downstream tissues suddenly starved of blood, but all that escaping blood builds up intense pressure and directly damages any brain tissue it touches. And just like the ischemic side of things, we have two primary variations of a hemorrhagic stroke, defined entirely by exactly where the bleeding happens. First up, we have an intracerebral hemorrhage. This is when the blood leaks straight into the brain tissue itself, which instantly causes damage and completely cuts off the supply to whatever that vessel was supposed to be feeding. The second type is a subarachnoid hemorrhage. This is where the blood releases not into the tissue itself, but into the space right between the brain and the skull. Now, to really understand that subarachnoid hemorrhage we just mentioned, we've got to look at what usually triggers it, an aneurysm. An aneurysm is basically a weakened, bulging little spot on the wall of a blood vessel. Over time, just the constant everyday pressure of blood pumping through can cause this weak spot to stretch and thin out, until eventually it just bursts open. So, seeing the sheer scale of the damage these strokes can cause, how exactly do we fight back? That leads us to part 4. Racing the clock with treatments. And this brings us right back to that ticking clock we talked about earlier. Brain cells are literally dying in minutes. Therefore, immediate, rapid-fire medical treatment is absolutely essential. The pure speed of the medical response is what dictates the ability to reduce brain injury and actually give the patient a shot at a meaningful recovery. Seconds literally equal brain function here. Now, the whole strategy relies on the fact that the medical response has to perfectly match the specific type of stroke we're dealing with. If the ER identifies an ischemic stroke, the blockage, remember, the entire goal is to clear the pipe. Treatments include intense clot-dissolving medications or specialized procedures to physically go in there and restore blood flow. Sometimes they'll even use a surgery called a carotid endarterectomy to clear blockages and prevent future strokes entirely. But following that intense acute emergency surgery for hemorrhagic stroke, the treatment doesn't just stop. Doctors will roll out additional, highly specialized medications. These are carefully designed to support normal blood flow in the chaotic aftermath of a rupture and to really help protect whatever surviving brain function is left as the patient begins that long road to recovery. So regardless of which fork in the road this takes, whether it's the suffocating blockage of an ischemic stroke or the violent rupture of a hemorrhagic stroke, the stakes literally could not be higher. Both types cause severe, often permanent brain damage, and both are immediately life-threatening. The brain is just too vital and its cells are way too fragile to survive these kinds of sieges without immediate professional help, which really leaves us with this final thought. We started out by noting that without oxygen, brain cells begin to die within minutes. You now understand the mechanics of the blockages and the bursts, and you know for a fact that immediate treatment is the only real defense we have. So, knowing all this, how will you react the next 10 seconds matter? Because when it comes down to a stroke, recognizing the emergency and acting incredibly fast isn't just helpful, it's quite literally the only thing that saves the brain. Thanks so much for joining me for this explainer, and keep learning.